So the liver is a powerhouse of metabolism, and it's a key uh, organ which metabolizes carbohydrates, protein, and fat. So whatever food you ingest, with the three big things, the liver is responsible for metabolism of all the three: carbs, protein, and fat. Additional, the liver is a very important organ to manufacture various hormones. It manufactures various protein molecules that the body needs. It also is a key pathway in all the enzyme reactions that the body undertakes. It also is important in excretory function. So all the waste products that come from the gut, the liver metabolizes them, detoxifies them, and takes it out through the bile. So liver is a powerhouse which controls many other organ functions. So if the liver fails, you can have a knock-on effect on the kidneys, the brain, the heart, the lungs, and your coagulatory functions. So the liver is a key organ to the body. What are the common causes of liver disease? First of all, in the world, hepatitis B and hepatitis C related chronic liver disease is the most common cause of liver dysfunction in the entire world, India included. So you must do a simple blood test, which is a check for hepatitis B and C virus. The next commonest cause of liver disease is alcohol-related liver dysfunction. More common in the Western world, getting more common in India. People with diabetes also have undiagnosed liver problem very often. Women who have an autoimmune tendency tend to have liver dysfunction. People who have long-term medications of certain kind can also predispose to liver dysfunction. So the doctor that you consult will be able to guide you if you have a chronic condition to check for liver dysfunction by doing a liver function test, by doing an ultrasound, and maybe a fibroscan of the liver. So in short, people who are hepatitis B, people who have hepatitis C, diabetes, obesity, people with other autoimmune dysfunction may be at a higher risk of liver dysfunction. With liver problems, unfortunately, there are no symptoms in the early stage of liver disease. So if you ask me whether you had any symptom in the past, most often the answer is no. So the liver, even if 99% of the liver is damaged, you may not have any symptoms of liver disease. Only when the liver comes to its last leg and the entire function of the liver gets compromised, that's when people present to us with jaundice, fluid accumulation in the tummy, fluid accumulation in the legs. People who can come with unexplained bleeding, bruising, etc. So often people who come to liver clinics are often asymptomatic. They have no symptoms, which is why proactive monitoring of any people who are at risk is very important. The liver is very important for overall health. As I said in my previous statements, is that it's a powerhouse of carbohydrate, protein, fat metabolism. So liver dysfunction would automatically lead to many, many knock-on functions. So you would start to lose weight. You would tend to have muscle wasting, bone wasting. You would have often slowing down of metabolic functions. So your brain would slow down, your toxins would accumulate, fluid accumulate liver, yellow pigmentation of the skin and the sclera, and the body would start to fail slowly. So it's very important that you look after your liver and you do not take any unlicensed medicines without the doctor's consent. When I talk about foods which help in the liver, of course, it's first important is to ensure that you have a good diet. So you need to make sure you have a carbohydrate low diet, you take a low fat diet, you have a protein rich diet. So eggs are a great source of complete protein for the liver. So you must make sure you have a high protein diet, limit the salt intake in your diet, and limit the amount of artificial flavorings products that you use. Additionally, it's important to limit the alcohol that one person intakes. A safe limit for alcohol would be less than 18 units per week for women and less than 21 units of alcohol per week for men. Avoid smoking. What you need to do is also have some antioxidants like berries, nuts, black coffee, green tea. These are great antioxidants for liver. In liver conditions, it's very important if you do take alcohol to completely stop alcohol if you have liver condition, because you don't want to add fuel to the fire. You need to limit your salt intake. You need to limit intake of preserved, tin, can, packed foods, which are rich in salt, rich in carbohydrates, rich in fat. So these things are very important to avoid to ensure good liver health. It's very important that we do not take any unnecessary medications like antibiotics, painkillers, herbs, vitamins, minerals without the consent of a doctor, because some of these medicines can cause adverse effects on the liver. People who are at risk of liver disease are people who have chronic hepatitis B, people who have chronic hepatitis C, people who take undue excess of alcohol intake, people who have obesity, particularly in childhood, people who have unexplained hypertension, people who have unexplained ischemic heart disease, people who limit the exercise intake and have a sedentary lifestyle are at the highest risk of liver dysfunction. So people with this problem, alongside people with dyslipidemia, having high cholesterol, high triglycerides, would be the people with highest chance of liver dysfunction. They must be monitored by simple sonographies, liver function test, and a fiber scan to check whether the liver is working at the optimal level or not. So if you've had an episode of a liver dysfunction or acute hepatitis, the most important thing in the future weeks to come would be to, first of all, limit any unnecessary antibiotics, any painkillers, or any other alternative medications which have no scientific basis behind it. Most important, do not take any medicines that are not required. It's very important that you follow a good diet, which would include boiled water or refined water. Limit the salt intake, have lots of green leafy vegetables, lots of fruits, a lot of antioxidants like nuts, seeds, which are very, very good for liver regeneration. We would normally recommend a good broad spectrum vitamin D supplement and alongside some antioxidants, which will help your liver to regenerate. It's also quintessentially important to increase your protein levels if your liver is not working well. So people who have eggs a day, people who can have a branch chain amino acid supplementation would be best chance to recover from liver dysfunction.